Welcome back. Today I'm joined by Cottie Petrie-Norris, our Assemblywoman, and she is here to talk to us about the importance of all of the things that the governor and all of our legislatures have asked us to do over the last 4 months. Well, Cottie, I know we've been, had you back here on and off for the last several months, and lots of challenges. So help us understand what is going on right now with COVID-19.
Well, good morning, Lisa. It is always such a pleasure to be here with you. Over the course of the last few weeks, we have seen a really alarming spike in the spread of COVID-19. All across the state and here in Orange County, we are seeing a growth in the rate of infections, a growth in the number of hospitalizations, and a growth even in ICU capacity. So here in Orange County, we have had more than 20,000 positive cases. Just to put that in context, over the course of the last 3 days, we've had more than 1,000 new cases each day. And our hospitalization rates are also rising. In the last 3 days alone, our hospitalization rates have increased by almost 10%. So this is serious, and we do need to take it seriously.
Right, and if you look at your chart, you've got the ICU patients at 234 and then non-ICU patients at 445. Does that mean that they're just in the hospital in regular beds, or what does that mean?
Yes. So they are serious enough to be hospitalized because of complications related to COVID-19, but not serious enough to need that intensive care.
Okay.
But those numbers are going up, and they're going up really quickly.
Right. Okay. Good to know, because, obviously we've got to, really take a hard look at some of these numbers. And if they're increasing that fast, we do have to be careful. So why do you think they're increasing? I mean, obviously we opened up. Sure, you're probably going to expect something like that. But what are some other factors?
Well, certainly, as we reopen the economy, as we loosened some of the modifications with our stay-at-home order, a certain amount of increase in community spread was certainly to be expected. But alongside that, we've also seen a really significant rise in the infection of the group that the governor calls the kind of the young and invincible. So the 21 to 34-year-olds who are socializing, maybe not practicing distancing, sort of going to bars and restaurants in enclosed settings. So we've seen a really precipitous rise in infection rates for that group.
What would you say to, someone who maybe has gone to a bar or even a restaurant and found that they weren't really doing what they were supposed to be doing? I mean, obviously there's certain parameters that many of these restaurants are supposed to be following. What would you suggest that an individual do?
Well, what the governor has said and what our local law enforcement agencies have said is that we really want to focus on education. We don't want to have to move to enforcement. We don't want to start to have to issue citations. But both locally and at the state level, if education is not working, we are in a position to step up enforcement efforts. And the governor and our state legislature, we are looking to our local partners to lead that. We think that is the appropriate place to have enforcement. We've also created an incentive for our local partners to enforce. So there is $5 billion of the COVID relief funds that have been set aside, specifically earmarked for cities, for counties that are enforcing. So if you're in a business and they are not practicing what you think are safe practices, I think the first step is to say something to the management, because I think sometimes the voices that are saying, oh, you're stepping on my freedoms, you're infringing on my rights, maybe are louder. And I think that there's a silent majority of people who want all of our businesses and all of our residents to take these basic steps to protect ourselves, to protect our families, to protect our communities and the people that we live with.
Okay, well, thank you for that. Hospitals, I mean, we have so many here. Are they all prepared and ready if there is going to be a big surge?
So yes, our hospitals are prepared. Over the course of the last 4 months, an absolutely Herculean effort has been underway all across the state and here in Orange County to ensure that our healthcare delivery system was prepared for a COVID-19 surge. So we have increased the number of hospital beds available by more than 60%. We've surged capacity across the state of more than 60%. We have increased the supply of personal protective equipment. And some of your viewers may remember hearing stories or reading articles over the last several months about just a really critical shortage in the supply of N95 masks and of surgical masks. Those are still challenges, but we have gone a long way to stabilize those supply chains. We have sourced and distributed millions and millions of units of these N95 masks, and we have millions in our state strategic stockpile. Alongside that, we've also taken steps to reinforce the medical staffing. I think on a previous show, I talked about the California Health Corps that the governor announced a couple of months ago. We ended up having almost 100,000 individuals who applied to be part of this California Health Corps. And as we went through the vetting and evaluation process, there's been 35,000 people identified who have suitable specialities, who have appropriate certification, and who could be deployed if we see a surge and need to do that. So obviously, we want to take steps right now. We want to be proactive and strategic so we avoid that surge. But I do want folks at home to know that we are prepared.
Right. And one thing we were talking about a little bit offline was, even though you still can go to the hospital if you're having situations like heart attack and stroke, and if you have something scheduled that is a necessary surgery, that is still happening right now, correct?
Correct. And we want to make sure, and I think I said this to you earlier, we want to make sure that we are maximizing the health and welfare of our entire community. And, part of that means ensuring that you are getting the medical care you need, whether it's for an emergency, for a surgery, or even if it's just for a regular checkup with your doctor. We need to ensure that people are still doing that.
Now, one thing that you mentioned is something I think the governor obviously is doing is, I think you referred to it as a dimmer switch. So
Right.
we're at a point now where we might have to roll back things, and we certainly don't want to go backwards. We want to go forward. So what are some of the current restrictions and closures now? You can help remind us what they are now, but what are they looking at? I mean, if things keep going up, we could go backwards.
Right. We absolutely want to make sure that we can continue to reopen this economy safely and responsibly. And, each of us have a huge role to play in whether or not we can do that and how quickly we can reopen, whether or not we are going to need to adopt further modifications. So last week, the governor announced it's sort of a dimming of that switch and some new restrictions for indoor dining and indoor bars. So across the state in 26 counties, which is almost 75% of the state of California, we have unfortunately had to suspend indoor dining and close bars. The hope is that step will be sufficient and that we won't have to go further. But the reality is that we are learning new things about this virus each and every day. And we are having to make modifications and to make shifts to ensure that we are protecting the safety and the welfare of our communities. But again, I would just reiterate that the speed with which we can reopen, the decision about whether or not we have to pull back, that is not just up to the governor. It's not just up to the legislature. That is up to you, to every single one of our viewers, and to 40 million Californians. And we can all take steps and little steps that have a really profound impact on our success or on our failure as we fight this disease.
Right. And I know that we just probably can't say it enough of all the things that we're supposed to be doing, like washing our hands and, wearing the masks and all the other things. Although, there are people who aren't necessarily doing what they're supposed to be doing. So what can we do about that?
Well, I think one thing that it's absolutely devastating has been the politicization of mask wearing. And this, to me, it is a common sense, it is a common sense step that we can all take to protect our neighbors, to protect our friends, to protect our families. And the way that I've been talking about it lately is when we go to the bathroom, when I go to the bathroom, like I wash my hands, not
Right.
because I'm afraid somebody is going to like burst out and give me a ticket or arrest me. It's because I've been taught that that stops the spread of germs. It is the right thing to do. And similarly, wearing a mask, it's not, I don't wear a mask when when I go to the grocery because I think somebody's going to arrest me or give me a ticket. It stops the spread of germs. It is the right thing to do. And so I'm going to do it to protect you. I'm going to do it to protect the essential workers that are showing up each and every day on the front lines to take care of us as we fight this disease. And I think, to me, it's not whether a mask is certainly not foolproof, because that's another objection sometimes people have. Oh, it's not 100% effective. The way that a scientist explained all of this to me in the very early days was that it's kind of like pieces of Swiss cheese. So yeah, there might be holes in some of the pieces of Swiss cheese, but guess what? If you layer enough pieces of Swiss cheese on top of each other, you're going to have a pretty effective barrier. And I think that, if each and every one of us can take these really simple steps, we can slow the spread of this disease. We can have a profound impact on our ability to fight it. And to me, it just comes down to, like so many things, like if we just source from a place of common sense and common decency, it goes a really long way.
Common decency.
Yep.
That's a big one, because you're right. I mean, there's a lot of people who, are outraged by the fact that, oh, you shouldn't have to tell me what to do. And it's really bizarre, because you'd think they would be worried about getting it too.
Right.
So
Right.
it's pretty crazy stuff, some of it out there. But,
Yeah. And I
again,
just
always,
hope I hope we can turn the page on the politicizing of kind of basic public health guidelines. Just, move on, because the reality is this is a really tough fight. This is a really long road. We need everybody, on the same team and rowing in the same direction if we're going to defeat this disease.
right. Exactly. All right, let's talk about some testing. So
Yes.
first, let's talk about the regular testing, which is for COVID-19. When do you want to go get tested?
Well, so there are two different types of tests that people are talking about. So the first kind of testing is what's called diagnostic or PCR testing, and that tells you, do I have COVID-19 right now? And the CDC guidelines say that we don't want everyone trying to get tested every week. Like we don't have the capacity that will overwhelm the system, and it's not necessary. So the guidelines are that if you have symptoms of COVID-19, and the symptoms, the primary symptoms are fever, dry cough, fatigue. There's also some people experience a diminishing taste, sense of taste or sense of smell. If you've got symptoms, you should get tested. And the best approach to getting tested is to contact your doctor, contact your physician, and they will set you up with an appointment in your area. For people that don't have health insurance or do not have a physician, if you have symptoms, you can still get tested through the Orange County Testing Network. And that is available for free for folks that do not have insurance. And so if you need to find out information about that, you can go to the Orange County Testing Network. In addition to people that have symptoms, for folks that are in high risk groups or are critical healthcare workers, critical first responders, high risk groups, so over the age of 65 or other health complications, if you have been exposed, if you've had close contact with someone who has tested positive, then we do recommend that you get tested as well, and that you reach out, same process, reach out to your doctor and work with them to get an appointment and to get that diagnostic test, which will tell you, do I have COVID-19 right now?
You know what? Sometimes when you're watching on the news, they have all these long lines of drive-up testing. Is that anywhere around here? Do we see that?
We have done I think we've done a pretty good job here in Orange County of managing kind of that throughput, and we've got testing sites all across the county. One thing that I do want to flag is, as the number of positive cases have increased, as the number of people that need to get tested has increased, we have seen a slowdown in the turnaround on testing results in some instances, because our labs are getting overwhelmed. And so that's one reason why we want to make sure that everybody who needs to get tested gets tested. But we don't want everyone, if you haven't been exposed, we don't want everybody showing up every single week to get a test, because that way we'll be able to manage the supply and demand here in the county and avoid those long lines that you've seen in some other places.
Okay, good. Because what, it only used to take a day, and now is it going up to like 3 days now?
Yeah, there are some places where it's gone up to 3 days. We've even seen in some testing sites it's actually higher. So we're working really hard at the county level and at the state level to continue to turn those test results around as quickly as possible, because that's absolutely critical. It's absolutely key in terms of our ability to control the spread, that people can learn as quickly as possible. Yes, you're positive, or no, you're negative. You're safe to go back to work.
Okay. And of course, antibodies is a big word now, and everybody's wanting to know, when are these antibody tests going to be available? Because lots of people think they've already had it. I mean, we don't really know, right? And if you get tested, then at least you're going to know. So what is going to happen with the antibody tests?
Yes, so antibody tests, they're the tests that tell you, have I had this disease? Do I have antibodies for COVID-19? And unlike the diagnostic test, which is the one where you get kind of the swab up your nose or down your throat, the antibody test is a blood test. So those are available. There's a wide range of facilities and clinics that are doing those tests here in Orange County. You can find out more information about those sites at the Orange County Health Info site, also at the California government COVID-19 site. And I do recommend people use those sites just so you can find a reputable provider, because it's kind of the wild, wild west where you've got stuff springing up and people are promising the world, but not necessarily using reliable tests. So it is, it's useful for people to get tested for antibodies, but I will also point out that there is still so much that we are learning about this disease, and that scientists around the world are learning about this disease. So right now, even if you test positive, even if it says, oh, you do have some antibodies for COVID-19, scientists still don't know what that means. They don't understand, does that mean that you have immunity to the disease? And how long do you have immunity to the disease? So one thing that's happening here in Orange County and frankly, all across the state and all around the world, are these really large scale, they're called serology studies, to start to understand, okay, how widespread is the disease, and what does it mean when people have had it, and what kind of immunity does it really confer? So Orange County, the Orange County Health Department is working really closely with UCI on a county-wide serology study. And those kind of learnings, we're still figuring it out, but it's sort of weeks or months away. And that is going to be so important as we figure out, how do we strategically then make decisions about who is safe to go back to work, who's safe to be in the community, and who is not so safe. So those lessons are going to be so important, again, as we work together to fight this pandemic.
Right. And it'll be nice to know when the antibody tests are somewhat foolproof, because like you said, there's a variety of people who are offering them, but you don't really know if those results are true or not. What resources do they have from your office?
We are here to help. And all of the information that we talked through, a lot of that is on my website. So a lot of the phone numbers and links to resources about testing, about other programs, about recent restrictions are available online. And the easiest way to find my website is just to Google Cottie, which is COTTIE. We also do have a dedicated page with senior resources for COVID-19. And again, easiest way to find that is Google Cottie Senior Resources. And if you need any other help, don't hesitate to call. Our phone number is 949-251-0074.
Perfect. Well, always a pleasure. You are a wealth of information, as always. I appreciate it. Thank you. And
it's good to
stay
see
healthy
you
out there.
Yes. Yeah. Stay well, be safe, and look forward to seeing you again soon.
All right. Thanks again and have a great day.
Okay. You too.
All right. And we'll be right back after this.